Hey everyone, welcome again to another video regarding healing after surgery. I have received some questions and also comments regarding those worries about the anesthesia itself, getting into the procedure of surgery. And, I'm feeling really scared about going under. Can you tell me a little bit more about that? So I do have some videos related to surgery day and anesthesia itself. And I'll link those up, but I do want to speak to this topic again since folks have been asking. So what exactly happened? Okay, so I got to my surgery center and I got all checked in. And then the preparation nurse, the prep nurse, called my name and brought me back. First things first, I had to remove all of my clothing, garments, completely everything. So be aware of that. They gave me footies, so little socks for my feet. They gave me a gown for my body. You can keep your underwear on, that's it. And then they gave me a cap for my hair or head, okay? I also, being an age of potentially bearing children, I mean, I'm at the geriatric age for that right now, but if you are a female and you're at the age where you could potentially be pregnant, they will ask you for a pregnancy test. So you will need to give a sample of urine in a cup to that prep nurse. All of my clothing, belongings, and everything I brought with me had to go into a clear plastic bag that they provided. So I went into a bathroom, got all changed, and put all of my stuff into a clear plastic bag. That prep nurse took my clear plastic bag and locked it away, so I did not have access to, my clothing or belongings. And then my prep nurse put an IV into my non-surgery arm. So she had to insert an IV. They run fluids during the surgery, and also the medications that help you to be out of it are put in through the IV. Some of them. Okay, I'll get there in a minute. The preparatory nurse asked me a bunch of questions, took my vital signs, chatted with me and helped me sort of stay calm and at ease. The surgeon did come in and briefly talk about the risks again, asked me if I had any questions, and then had me sign a consent form, which I did. He also put a mark with a marker on my elbow that I was having surgery on, so he's sure he did the right one. As he was doing that, the preparatory nurse was actually pushing in a medication, an antiemetic medication. And that means a medication to help you not get nauseous from the anesthesia medication. Because I was actually more worried, not so much about the going under, but like, how am I going to feel when I come out of it when I'm going to be nauseous? So the prep nurse pushed that medication into the IV as I'm talking to the surgeon. So it's so easy. It's so natural. They're doing their jobs. They're taking care of you, and in such a manner that it did not give me any anxiety. So after the surgeon left, then the anesthesiologist came in, and that person talked to me about the fact that I was getting a block in my neck. It was going to be an injection, and it was going to numb the whole arm. And that anesthesiologist was going to watch the numbing of the arm as well as the fact of me being out of it so that they could perform the surgery. They make sure that you are out of it so that you don't wake up during surgery. They're making sure that you're out of it so you don't feel the surgery. The anesthesiologist is monitoring all of that. And he also put a black mark on my neck on the side of the body. So again, to make sure it was all correct. That was pretty much it. And then the operating room nurse, who was dressed like me in a cap and scrubs and footies, came and got me. So I took my little IV bag and I walked with her back to the operating area. So people ask, can you feel the going under? No. I literally was talking about holistic therapies, Reiki, healing energy, and I was talking about Reiki. And the next thing I know, I was waking up from surgery. Okay. So no, you do not feel the going under. And no, you do not feel the surgery if they are monitoring the going under. And no, when I woke up from surgery, I was not nauseous. I did not get sick. I was not completely out of it and whatever crazy. because they monitor all that with the medications that they put in through the fluids that are running through the IV. So I know the going under sounds scary and the fears of how is this going to happen? Am I going to feel it? Trust me, you will probably be talking about something and next thing you know, you're waking up. Again, if you have more questions about this, if you want to comment on how it went for you, please feel free to do so below. As I said, I've had lots of videos in this series about surgery, the surgery day itself. You can check out more videos in this playlist. And if you'd like to connect or find some more resources, visit me at my website, which is elizabethscala.com. And until then, have a good day, live sublimely well, and we'll see you real soon.